Well, using psychedelic drugs like ecstasy or magic mushrooms to treat mental health conditions might not be as far out as it sounds.
Yeah, the latest research shows that these substances can be used effectively in the psychiatric care of some disorders. KITV4's Paul Drews shows us how Hawaii is preparing for more possible psychedelic therapies.
Well, imagine someone getting rid of their antidepressants and feeling just as good or even better. You might think they must be tripping, and according to an island doctor who specializes in psychedelic therapy, they are. And these types of Hawaii therapies could expand in the future. Cleaning can be a chore to some, but for Shyla Manny, it is part of her obsessive-compulsive disorder.
I have what's called contamination OCD, so cleanliness, hygiene, that is my primary concern.
Compulsive cleaning and repetitive thoughts of hygiene was one way she was able to take control of her life after suffering earlier trauma.
I like to have elements of control, predictability, and certainty in my life. That helps me to feel safe.
After dealing with her obsessive-compulsive disorder for years, using drugs to control those compulsions, she tried ketamine therapy, a psychedelic drug used legally for several years in Hawaii to treat a variety of disorders.
I can get more than half of people with major depressive disorder to reduce or eliminate their antidepressants altogether.
For Shyla, after using ketamine to open up her mind, she was finally able to open up to new things.
I have gotten more comfortable with relinquishing control to the point where I actually look forward to it.
While she says her ketamine therapy was effective, it wasn't cheap. That's because even though it is legal in Hawaii, it's not covered by insurance.
Ketamine has been proven in a large randomized trial in France to be the only treatment that reduces suicide thoughts. And yet we have most commercial insurances won't cover it. That's the ethical equivalent of denying someone's EpiPen.
But that could change in the future as the state looks at possibly expanding therapeutic use of psychedelics, including psilocybin, which is known as magic mushrooms, and MDMA, otherwise known as ecstasy.
The FDA just released a couple of years ago that psilocybin is a breakthrough therapy, and so with that designation, that federal designation, states are now coordinating conversations and regulatory approaches on to how to receive that and how to implement it into a health system.
Hawaii now has a working group of lawmakers, health professionals, and drug policy reform advocates to shape how the state could regulate access to additional psychedelic therapies. And more mental health therapies are needed, especially in the wake of the deadly Maui fires, which greatly impacted thousands of island residents.
With more people experiencing trauma, we need to provide as many options as we can in order to mitigate those impacts of post-traumatic stress, depression, anxiety.
Shyla feels ketamine worked wonders for her. And Dr. Cook says patients find it easier to accept the idea of psychedelic therapy than another important island group.
It's harder to convince actually my doctor colleagues and as well as lawmakers because there's such a cultural fear. But once people delve into them, the healing becomes so personal that cultural baggage kind of becomes irrelevant.
Now, after informal meetings, Hawaii's Breakthrough Therapies Task Force will come up with recommendations before the next legislative session. And that means in a few months, lawmakers could end up voting on whether to expand psychedelic therapies in the islands. Paul Drews, KITV4 Island News.